We're looking at this really groundbreaking idea where researchers have found a potential new way to treat depression by targeting the immune system.
Got it. Right. And they're saying that in at least some people with depression, the immune system might actually be playing a role in the symptoms, right?
Exactly. It's like they've discovered that the type 2 immune pathway, the one that's also active in conditions like eczema and allergies, is elevated in people with depression.
Yep. So we're talking about the T helper 2 cells being overactive. That seems pretty surprising given how we usually think about depression.
Yeah, it's surprising indeed. The researchers compared immune markers in people with depression, those with inflammatory skin issues, and even healthy controls, and found similar dysregulation in the type 2 pathway.
Right on. And then they used computer modeling to figure out which drugs might dial down that excessive immune response, right?
Correct. It's like they predicted that dupilumab, an antibody we already use for treating eczema, could help normalize this pathway. They even tested it in a mouse model of depression and saw promising results.
That's pretty fascinating. But I'm wondering, don't you think targeting the immune system might oversimplify the complex nature of depression?
That's a good point, and the scientists are aware of that. They believe it could revolutionize treatment for a subset of patients with treatment-resistant depression, where inflammation is a key factor.
Sure, that makes sense. So if the immune dysfunction is really significant in these cases, modulating that might improve the brain's reward system, which apparently is suppressed by inflammation.
Exactly. They observed that inflammation may dampen the brain regions involved in pleasure and motivation, like the nucleus accumbens. And it's quite exciting because it opens the door to personalized treatment options based on a patient's specific immune profile.
Yeah, exactly. Now, I'm also curious about the potential side effects. Since dupilumab is an immune modulator, is there any risk of compromising the immune system overall?
That's an interesting challenge. The beauty is, unlike old-school immunosuppressants, dupilumab seems to correct the immune response rather than shutting it down completely. It brings the system back to a more normal range without, increasing the risk of infections.
That's reassuring. So overall, this could be a huge shift in how we approach depression treatment, particularly for those who haven't responded to other therapies.
Absolutely. It's a fantastic example of how understanding the interplay between the body and the brain can lead to totally new treatment strategies. The upcoming trial will really tell us more about, which patients can benefit most.
Right, it's definitely something to keep an eye on.